Good morning, everyone. This is going to be an awesome chat today. I am so excited because the time has finally come that I'm going to be getting my tongue tie release next Tuesday, July 30th. And I have been wanting to share the amazing doctor that is going to be doing this procedure with all of you because this has been a life-changing experience for me. So we're gonna just kick it off with Dr. Zaghi. He is a sleep surgeon. He is the founder of the Breath Institute in Los Angeles. His interest of study is the impact of tethered oral tissues such as tongue ties, oral myofascial dysfunction, and maxillofacial development, upper airway resistance syndrome, obstructive sleep apnea. So he works with a whole host of issues pertaining around the mouth, the nose. So even if you don't think you have a tongue tie, there are so many things related. Pretty much everything begins with the mouth. And the tongue, just so you know, fascia from the tongue starts at the tip of the tongue all the way to the toes. That's how important and how connected it is to every area of the body. So without further ado, we're going to bring in Dr. Zaghi so that we can get this conversation started. Questions? We're going to be doing questions today, please.
Hi, good morning.
Hey,
Great
good
to
morning.
see you.
You
Thanks
as
so much
well.
for having me.
I'm so excited for this conversation. I have been dying to share the world, you, with my world because you are the best at what you do. And
Appreciate it.
there's no one better that I could think of to share what we're going to talk about today. My experience, what I'm going through, your experience, and then not only the tongue tie, but everything as it relates. So I guess we will start with, give me a little bit of your background.
Yeah.
We'll make that short and sweet.
Absolutely. My name is Soroush Zaghi. I'm a graduate of Harvard Medical School, UCLA ENT residency, and Stanford Sleep Surgery Fellowship. And the reason I went to all that schooling is to really be able to help patients with sleep, breathing, facial development disorders. I'm a student of Dr. Christian Guilleminault, and during my time in fellowship, he really turned me on into addressing the root cause for why a lot of people have sleep and breathing disorders. And Dr. Guilleminault had discovered the concept of sleep apnea, the concept of upper airway resistance syndrome, and he inspired in me that desire to really understand things from a root cause basis. And that's where he opened my eyes to tongue ties and how they affect chewing, swallowing, facial development. And from there, we developed the Breathe Institute, where we take care of patients with sleep, breathing, maxillofacial issues. We also have a very robust research and education program with over 2,500 ambassadors and affiliates throughout the country and throughout the world.
Now, those ambassadors are those people that you are educating, so other doctors and facilitators that are learning your method and understanding so that they can spread it out to the world?
Absolutely, yeah. So when I was at Harvard Medical School, they really inspired in me this concept that, you could be a great surgeon and you can help, X number of people. And so in my career so far, I've maybe treated 4,000 tongue tie releases, maybe 10,000 patients. But you can have a really massive reach if you're able to validate the work that you're doing through research and to extend that through education. So we have published on our techniques, on our protocols, continue to do so. And we have a very strong following of dentists and doctors and myofunctional therapists and orthodontists and ENTs who follow our work and our research. And we give courses and seminars to really elevate the level of care they were able to provide individuals really throughout the world. And so now we have at least 3,000 offices throughout the world who are emulating our protocols and looking to us for answers to difficult questions. And through that, we've really touched, hundreds of thousands, if not millions of patients over the last, 8 years of developing the Breathe Institute.
You answered one of my questions that I had on my list down the list of questions, which was when we're talking today, if there are people out there that are saying, hey, I think I might have this, I've got these symptoms, but I can't get to LA, you have a resource, basically a hub of resource on the Breath Institute so that they can find some provider in your area in their area that does your type of technique.
Absolutely. So we have a very, very robust network through the Breathe Institute, and we have different providers that I'd like to mention. The first is our ambassadors. Our ambassadors are individuals who are like-minded, have maybe taken like a 4-day course with us. We have our affiliates who have studied for at least 2 years and have done surgical proctoring, over-the-shoulder one-on-one with me and me with them, so that we can really endorse and see the work that they do hands-on. And I also want to give a shout out to our Myo Mastermind, Myofunctional therapists. And so we have a couple hundred Myo Masterminds throughout the country who are individuals who dedicate 9 months or more as dental hygienists or speech therapists to helping patients patients navigate the process of understanding, do I have a tongue tie? Do I have a narrow palate? Do I have big tonsils? What can I do? What are my options? And, really helping patients 360 degrees.
Okay. Oh my gosh, I have so many questions. All right, let's just, because there are so many questions, let's start from the beginning. What is a tongue tie?
Yeah. A tongue tie is a condition of restricted tongue mobility due to the presence of connective tissue from the undersurface of the tongue and the floor of the mouth. So basically, you're not able to lift up the tongue because you have restrictive tissue. All right, let's see here. Tethering the tongue down. So there's a little frenulum here that's too tight, and it affects the mobility of the tongue, not only sticking out the tongue, but also lifting up the tongue. And it turns out that it's most important not only to be able to stick out the tongue, but to be able to lift the tongue. Not only the tip of the tongue, but actually the mid-body of the tongue. And over the past few years, we've actually come to understand that problems affecting the mid-body of the tongue, such as posterior tongue ties or mid-tongue restriction, can significantly impact chewing, swallowing, facial growth, development, sleep, and breathing. And we've developed very key mechanisms to identifying when the tongue tie is causing an issue and what are the situations, the context in which we can ensure optimal success from a release procedure. Okay, so we all have, this is the confusing part when I started sharing my journey on social, is that we all have a tie under there to some degree. So it's a matter of, the tie part is normal part of the tongue, right? It's just a matter of if that tongue happens to be too tight in your specific body versus Susie's. Exactly right.
Okay.
Exactly right. And so, we have developed a grading scale, all right, that can help you understand what are, typical or normal ranges of tongue mobility versus not. So you can see in this bottom example, this individual can barely lift up the tongue 25%,
wow,
where average is around 60%. This individual can lift up less than 50%, and this one is like fully mobile. And so depending on how much of the tongue you can lift up versus not, we can, classify patients into, significantly below average, slightly below average, or above average. And, it's a combination of how restricted the tongue is, but also whether or not you have enough space in the mouth for the tongue and other issues, including the tongue tone. And so by considering the restrictive nature of the tongue tie, the strength of the tongue, and the space inside the mouth or the tongue, we can determine whether or not a release procedure would be beneficial for that specific individual. Okay, so there's also, this is amazing. Let's expand. I know from my research that there are more than one tongue tie possibilities in the mouth. Can you briefly show where else there might be an issue? Absolutely.
Besides just the...
So you have a frenulum all over your body, and inside the mouth, you have connective tissue that adheres the lip as well as the cheeks inside the mouth. And so if, for example, you have a lip tie, this can impair mobility of the lip and the nose muscles. If you have a lower lip tie, it can impair functioning of the lower lip, and cheek ties can also significantly affect breastfeeding, for example. And so if these frenum are overly restrictive, releasing them may be one option. Now I say it may be one option because not all restrictive frenulums require a release. There are other options. And really that requires an understanding of what is a frenulum made of. And the frenulum is made up of mucosal tissue, fascia, and sometimes muscle. And so basically there are some circumstances in which the fascia is too tight, and there are mechanisms of doing myofunctional therapy, body work, and even non-invasive laser therapies such as orally to loosen up the fascia. And so sometimes the fascia loosens up and no intervention is necessary. Yet other times we discover that the fascia has deeply invested and made knots into the muscle and the mucosa. And no matter how much therapy you do, no matter how much stretching you do, that tongue is restricted and needs a surgical release.
Okay. Oh my gosh, this is so good. So let's talk about my experience, about mine, because then we can do some questions around it. I found out, I went to my dentist. My first question is, why is this not being more discovered? I went to a new dentist. I've been going to a dentist twice a year, pretty much my entire life, and had aches and pains and all kinds of things. And no one ever said, hey, maybe it's your tongue. So I went in, he says, I think you got a tongue tie. I think, you got to get that fixed. And I'm like, what? I went down the rabbit hole. He said, you go call this doctor. I called this doctor. And they said, first you have to go to a myofunctional therapist. Okay, myofunctional therapist. which I guess we'll stop right there. Two questions. Why is it not being diagnosed all these years? And then two is, why do I have to see, or why should I? Because this is the other question is, versus not just going to any dentist that says, hey, and snips it. Like, I think that's catastrophic. Why do you subscribe to the philosophy that you must go get the examination and treatment, exercises, working with the myofunctional prior to?
Terrific question. So the answer to that question lies in the fact that tongue ties are both underdiagnosed and overdiagnosed.
Okay.
And when tongue ties are overdiagnosed and overtreated, they can cause catastrophic complications, especially in infants who are struggling to breastfeed. And doing a tongue tie release when not indicated on an infant can lead to difficulties with breastfeeding, the potential for bleeding, and complications that result in that infant going to the hospital. And it only takes one or two really sad cases to concern pediatricians enough that they have a really high threshold before they suggest this intervention to their patient. And so pediatricians are taught to be very careful among providers who are a little bit too eager to cut and snip and do a procedure on a brand new infant. Now, this has resulted in pediatricians being taught to stay away, that this is just a fad, and including New York Times publishing an article suggesting that these procedures can have complications. And it's true that you can have complications, but if these procedures are done correctly, according to the proper protocol that we teach in our seminars and in our courses, you can have a very high satisfaction rate with low complications. And so in my most recent paper that I'm going to be publishing later this year, I've showed that the complication rate is now limited to only 1 to 3%, whereas before and in some other practices, complication rates can be as high as 25 or 50% after tongue tie surgery. And so if you're just going in to get a tongue tie release, the major complications that you can experience are, number one, reattachment or scarring. That means that you go in to improve your tongue mobility, but you leave with scarring that actually worsens your tongue mobility. And this is the most common complication that we see. Terrific question. So the answer to that question lies in the fact that tongue ties are both underdiagnosed and overdiagnosed. And when tongue ties are overdiagnosed and overtreated, they can cause catastrophic complications, especially in infants who are struggling to breastfeed. And doing a tongue tie release when not indicated on an infant can lead to difficulties with breastfeeding, the potential for bleeding, and complications that result in that infant going to the hospital. And it only takes one or two really sad cases to concern pediatricians enough that they have a really high threshold before they suggest this intervention to their patients. And so pediatricians are taught to be very careful among providers who are a little bit too eager to cut and snip and do a procedure on a brand new infant. Now, this has resulted in pediatricians being taught to stay away, that this is just a fad, and including New York Times publishing an article suggesting that these procedures can have complications. And it's true that you can have complications, but if these procedures are done correctly, according to the proper protocol that we teach in our seminars and in our courses, you can have a very high satisfaction rate with low complications. And so in my most recent paper that I'm going to be publishing later this year, I've showed that the complication rate is now limited to only 1 to 3%, whereas before and in some other practices, complication rates can be as high as 25 or 50% after tongue tie surgery. And so if you're just going in to get a tongue tie release, the major complications that you can experience are, number one, reattachment or scarring. That means that you go in to improve your tongue mobility, but you leave with scarring that actually worsens your tongue mobility. And this is the most common complication that we see. The other complication that we see is poor surgical technique, resulting in bleeding, salivary gland, or nerve injury, which is why patients really want to be careful when choosing a release provider who's adequately trained to both perform the procedure and have a thorough understanding of the pre- and post-operative myofunctional bodywork and tongue space issues that are necessary to address to optimize your chance that you will have a successful outcome.
Right, and I'm hearing horror stories of literally people just go in and they're snipping it left and right, and then they have issues afterwards, which is just really, really sad. So
no, absolutely. So, for example, if we can talk about your case,
yes,
You were
Yes.
born with a tongue tie.
Right. And I guess I should say too is I'm 54, so I feel like there's a whole generation. Obviously, it seems like there's more tongue ties happening now than certainly when I was born in 1969. So I don't know. Obviously, if that has something to do with it as well.
Yeah, absolutely. And some of that has to do with our medical system and education in terms of infant care, as well as medicine versus natural holistic modality. So in this country, we have a bias toward research, randomized controlled trials, medication that we can give to fix problems, and not so much on body work, physical well-being, exercise, nutrition. Yet in other countries, for example, in India, when a baby is born, the baby straight away is stretched out and is given an oil massage, and all doulas, they just release underneath the tongue. It's just routine fashion.
Wow.
Yet in the United States, the first thing that happens is they clean you off right away. They put you in a sterile towel and they wrap you tight, tight, tight. Now, the problem with this tight, tight, tight is that you are in the womb for a very long time. You have fascial tension all over your body. And what the babies really need, not just some babies, but all babies, is movement, stretching out. And so in other countries, it's just a normal process. Yet in this country, we, specifically seek out modalities of bodywork and craniosacral therapy and physical therapy for our babies that are just too confined. And so by having an understanding of these natural, holistic, functional modalities, we're able to help babies, but also adults.
Okay, so I go to my myofunctional therapist, and I'm at this point invested because I have done enough research for myself that said tight neck and shoulders, body ache, TMJ, forward head posture, tight hips, migraines, exhaustion, poor sleep, snoring. I had all those things, and I thought, holy cow, if that is connected to this and I can get relief, I have found the answer to the healthcare crisis, because so many people suffer from those other things. And not that it's the only reason, but I also know everything starts in the mouth. So that's why I decided. I go, they're looking and they're like, oh, you need to go to the specialist. You need to go see. And so then I end up with you. So let's talk about my case and all of the intricacy. This is much more than I ever bargained for. I thought I was going to do my exercises with my therapist, who I did for like 5 months prior to meeting with you. My tongue was lazy. My tongue was wasn't doing anything. It was just like hanging out free for the ride.
Oh, totally. So here's the picture that we took at our pre-screening together. First of all, look at how fabulous you look now. You were beautiful then, but even more so, look at your cheekbones and your facial structures and how your posture has opened up. And so when I assessed you, I saw that you did have a restrictive lingual frenulum. And I can see this frenulum is affecting not the tip of the tongue, but really the body of the tongue, this posterior aspect. And so over your lifetime, this tongue tie has caused multiple issues, including chewing, swallowing, neck and shoulder tension. But most relevantly, it affected the way that your upper jaw had developed. And so based on our assessments and CT scannings, we saw that you had a tongue tie, but you were also compensating for limited tongue space. And, one thing that individuals do when they don't have enough room in the mouth for their tongue is that they put their head forward, and this can also result in neck and shoulder tension.
All the
and so
time. Let me tell you, for a lifetime, it is like a rock. I can get massages, and I do several times a week. I can get them every day. It stays like a rock. And just an FYI, even when I do my tongue tie exercises, my shoulders, it hurts so much just to do it all. You can see it here.
Absolutely. And so your tongue tie in particular goes quite deep into the muscle tissue. Okay. And for you to get a good release, we have to release the mucosa, fascia, but also, intricately get around, critical nerves and artery structures in order to give you an appropriate relief. And so in order to have a good outcome with no complications, one limiting factor was that you didn't have enough room in the mouth for the tongue. And when you don't have enough room in the mouth for the tongue after these procedures, some patients develop swelling, and the swelling can worsen the breathing and also cause poor wound healing that can cause complications for patients, including salivary gland issues, worsening of snoring, sleep apnea, and excessive scarring. I have seen some patients, and it's very concerning to me, by other doctors who get in there, they go very deep, and there are some patients who've even had to go to the ICU and spend some time in the hospital because of complications that have arisen. But now that you have the space, you've done the therapy.
Hold on, let's tell them what I did.
Yeah.
Let me just say, after you did, I thought, oh, this is my pre-op
Right.
appointment with Dr. Zaghi. I'm going to book it in 2 weeks. It's going to be amazing.
Exactly. And I said no.
He pinned me. He popped the bubble. I was defeated. I was so defeated when you said you're too risky. And tell them, why was I too risky? Also, my airway was like the tiniest thing
Yeah,
ever.
let's take a look at it. Let's go take a look at it.
Yeah, let's show them why.
Hey, team, do you guys have our airway up?
Can
you put up Venus Chamberlain's airway, please?
Yeah, and also I should say to our viewers that when I was working with my myofunctional therapist, I had a C scan that shows everything, and I also had a sleep apnea test, and it was moderate, to which I was shocked. I was having episodes of not breathing every hour, which is very frightening.
Absolutely, absolutely. Let me have my team pull up your CT, and then once there it is. So, one thing that we look at is the mobility of the tongue. And if you just want to lift up your tongue for everyone to see, all right, you do have limited tongue mobility, especially in the body of the tongue. Yet, in adult patients in particular, we have to make sure there's enough room in the mouth for the tongue. So here was your CT scan from February, all right? And so this is showing your upper jaw, this is your lower jaw, and the space inside here is your tongue. Now, the typical space that we like to see is about 1 to 1.5 centimeters of room. But in your situation, the tongue is blocking the majority of your airway. You have a 1 to 2 millimeter airway with extreme forward head posture that is opening up your airway. And so in this circumstance, if we get in there, you can imagine how we might cause, 1 millimeter of swelling, and that would close off your airway, contributing to further swelling of the tongue. And I've seen tongues get, purple and blue, and people struggle. And so, it's very important to do the whole process. Pick the patients who are going to thrive and to manage the ones that may need a little bit more attention. And so in your case, you had a very narrow airway, and you had a very narrow palate. And I said that I can change your life, but you have to do it according to the protocol that we have shown and proven to work. If you do it any other way, you're going to be on the New York Times article that we did a procedure and you're worse. And so we're thankful to our patients and to the research training that we've had and the hundreds of patients that we've studied, so that we can come out with exact and precise metrics that tell us who is going to be thrilled and have an amazing result, as you will when we do your procedure next week, and who may be a more complicated case. So I really feel like we saved you in a way.
Okay, so hold on. So you said, I'm not going to do it. You said, except for, and I said, I think I know what you're going to say. So what did you say I had to do?
You had to do palate expansion. There it is. All right. You had to get your mouth bigger, and it is possible. And we've also researched how to do mouth expansion in a very predictable fashion for patients of all ages. We're talking babies that you can do intraoral massage on, 3, 4, 5 years old, to no age limit. No age limit. We know how to do it effectively, safe, precisely. And I came in with a lot of confidence, and I said, for you and your anatomy and your bone density, this is what you have to do. And your orthodontist got on the phone with me and tried to negotiate with me a little bit. And I said, no. This is what you have to do, okay? And you went ahead with Dr. Manueli, and you had a terrific result that we supervised and made sure. And your bite looks phenomenal. Your cheekbones, your airway.
I love it. It's a facelift. You said, Vanessa, you're gonna look 10 years younger. You're going to love it. It's like an incidental facelift. And I swear it is.
Absolutely. You look terrific. And I remember you said, I'm an influencer. I can't do this. And I said, Vanessa, this is going to be the best thing you've ever done in your life, for your career. And I told you, own it. And
you did. You are the one, you said it. And I swear, it's just like when I ditched the hair dye. I had that moment of, and I did, and I started sharing it. And I swear, and I mentioned this to you on the phone the other day, is literally, I have had more opportunities even with beauty brands, when I had a gap that was, I could stick my finger in between it. And they were still accepting and saying, so I've been busier than ever, even with that. And you know what? It's helped me. More self-acceptance.
Absolutely.
You know what? More self-acceptance when when you've been connected to your self-worth on your beauty, and that's how you're lovable. That, the gray hair is one thing, but I'll tell you what, you start getting a big gap between your teeth. That'll, that'll
I
rattle your
hear you.
pain and
I get it. I get
renegotiate.
it. I hear it. But we walk the walk, okay? So this is something that I went through personally myself.
Yes, you did it.
And when we're with our patients, I recognize that it's not just telling you, it's giving you the confidence and the support. We talk about structure, function, and behavior, and we have to make sure that whatever intervention we're recommending our patient, that they're mentally, physically, emotionally supported so that they can thrive. And so I'm so happy that we were able to connect with you, give you the confidence that you needed through our research and experience to get the care that ultimately has gotten you to this amazing position that you are now.
Okay, so I do all the myofunctional therapy. I'm doing that every day, and I have seen the improvement on in my tongue. Now I start tonight, actually, my first craniosacral doctor. I'm going to do some body work in preparation. I'll also be meeting with one of your therapists that works with you the morning of. Tell us why is it important to have that body work in preparation, pre and post the tongue tie release?
Absolutely. So we have to recognize that the whole body is connected from the tongue to the diaphragm, all through a system of connective tissue known as fascia. All right.
Okay.
And so if you have fascial tightness in your body, this will affect your tongue. And if you have fascial tightness in your tongue, it will affect your body. The two are really interconnected. And so let me just show you this picture here from my website with some testimonials of the deep front line of fascia. This is showing how the tongue is connected to the diaphragm, to the chest, to the pelvis, all the way down to the knees and the toes. And so if you have a fascial restriction, it can cause tension throughout the entire body. Releasing that tension pre-operatively requires me to make fewer incisions to let go of the posterior tongue tie, and the less that I need to cut, the more precise I can be with my cuts, the less scarring you'll have and the better outcome that you will experience. So by doing the body work and the stretches preoperatively, we're removing all of the fascia except for what I need to cut at the time of the surgery.
Okay. I have a question. Does mobility only concern the underside of the tongue? This is a couple questions that people had sent in.
Yeah. So the tongue is connected to the floor of mouth through the underside of the tongue, but the mobility of the surface of the tongue is what is usually affected by it. And so you're having difficulty lifting the top of the tongue because the whole tongue body is held down. And so let me show you this picture of the tongue tie, showing how the restriction on the undersurface of the tongue is actually affecting the surface of the tongue. Do you see that there? So this is an individual with tongue tie, not able to go up the top of the tongue, actually.
Wow. Okay, I have something called the pectus excavatum, which I mentioned to you, where I have a concave chest. And I wanted to do research. I was looking, I found one article that said in babies could be connected, because I've had, and it's gotten a little bit worse. You said that you have seen or heard that some of it could be connected?
Absolutely. Yes. So I just showed you that picture of the deep front line of fascia, and we have to recognize that the whole body is connected. And so you really ask, why would the chest sink in like this? Okay. Why would it develop in that way? And so we have to also recognize that there's fascia in the chest and the diaphragm that connects all the way through. And if you have fascial restrictions, either because of tongue tie or because of lack of mobility, the constriction brings your shoulders forward, sinks your chest down, and over time it gets tighter and tighter. Imagine that you have your shoulder in a bandage and you don't move it. Over time, it gets tighter and tighter and tighter. And so releasing tongue ties, working on the physical therapy, good chewing, swallowing can improve actually whole body posture.
You know, it's interesting because this didn't even show up until I was about 20 years old. My entire life, I get pictures, which I found to be interesting because normally you would see it. I looked at all these pictures,
so you
it
keep
just happened.
going forward and forward and forward, and the fascia gets tighter and tighter and tighter and tighter.
So with the best hope, what is the best hope for me? We go in on Tuesday for my release. I've seen some videos, and it's extraordinary when you're literally in real time doing it, and I see feet going like this.
Yeah,
I mean, I'm praying for one of those.
I have a really good feeling that you're going to have an amazing experience. You've done everything right. Your case is set up for success, and I think you're going to experience not only like a physical, but also like a mental and emotional relief, because the fascia system actually carries memories. If individuals have had a history of TMJ issues, a lot of pain, or even like oral trauma or abuse, the fascia keeps those memories.
Wow.
And when you release it, you can just have this catharsis of a physical and emotional release. And we're so excited to guide you through that process.
Yeah. So what is after you get kind of hopefully an initial kind of release, what's kind of the long-term expectation, especially if I continue with my myofunctional therapist, continue with body work, how long out do you generally see kind of positive improvements
That's a great
from the release?
question. So, in terms of an immediate benefit, like an immediate noticing it, all patients will experience improvements to their tongue mobility. We can demonstrate that. Some patients are just a little tense during the procedure and they don't let go enough to really experience the top down. And that may take a couple days in some situations and a couple months in other situations, depending on how much pre and post-operative work that they've done. So we try to create an environment where you're calm, where you're relaxed, and the body can go through its process. Yet if we don't get that release now, you still have the post-operative body work opportunity to further that release process. So, it's only about 10 or 15% of patients that actually experience that catharsis on the spot. Okay.
Really? That's
Yep.
That's a low percentage.
That's low.
I would have thought it would be more.
You would have thought,
okay.
But because it has to be like the perfect environment, the space, the tone, the physical, but also the whole body has to be in like a relaxed state for it to happen. If an individual is coming up like really tense, you may or may not experience it if you're not like present in the moment. It's those individuals who really sink in and are present and trying to feel it, okay, who are very like empathic and aware, that will experience that. But if you're trying to be distracted, listen to music or something like that, the results can be mixed.
Interesting.
Some people have emotional catharsis. Other people, they deny their emotions. They're trying to keep it in. Happens a lot with men. They trying to keep it together. And then what happens is their heart rate starts to come down and they can have something called vasovagal syncope where they get lightheaded or they get faint. And so it can be an unpleasant experience. So, the best circumstance during a procedure is just to come in loose fitting clothing, meditate, just be in like a good mood, set an intention that everything is going to go well, and, surrender to it and try to like enjoy the experience, for what it is.
So tell the viewers what's going to happen to me. Like, how long does it take?
You're gonna come in. We're gonna say hello. We're gonna review your tongue tie. We're gonna review your CT scan again. Make sure we're on the same page. Look in your mouth, nose, jaws. Make sure we're totally on the same page in terms of what to expect and how things are gonna go. Then we go over the pre and post-operative information. We put some topical anesthetic on the tongue, small injection in that area, and then I use a combination of hemostat, scissors, and lasers to complete the release. Step by step.
Scissors and laser. So it just depends.
Yeah.
You use both.
I usually start with the laser and I might snip at the end with scissors if necessary.
Okay.
I predominantly use laser and sometimes use scissors just to kind of clean up the edges.
Okay, beautiful. And how long is this procedure?
We allot about 45 minutes for it and maybe about 5 or 10 minutes actual cutting time.
Okay.
Because we want to support you just for you to be in the right kind of frame of mind. So it's not like a rushed experience, but the actual procedure time in your mouth is about 5, maybe 10 minutes max.
And you're obviously, so you're awake. So you're questioning, you're saying, as we're doing this, you're going to be asking me and having me move my tongue and things.
To my anatomical understanding. If I see certain fibers, I may ask you to stretch in a certain way. Once I think I've hit my endpoint, I'll give you a break. I'll let you stretch out a little bit, move your neck, kind of check in with yourself, make sure you're doing okay. Swallow a few times. We recheck it. Any final touches, and then we close.
Okay, so then you finish up and you send me on my way. What's the healing procedure? I know I have exercises post-operative with myofunctional that I will be doing.
So you may experience 3 to 5 days of mild soreness and pain treated with Tylenol and ibuprofen. We also recommend ice therapy. You can also do cold laser therapy to help minimize inflammation. Nutrition is really important, so anti-inflammatory diet, Epsom salt baths, just making sure your whole body is nice and calm is the best thing to do. You don't want to have a tongue tie release procedure and then go run a marathon. You want to let your body heal and relax, eat good, nutritious foods, mind, body, have your whole system be in a place of healing. And so,
are there stitches?
There are sutures there. You can usually eat, soft foods to start, work your way up to regular foods. The sutures fall off on their own. And then somewhere about 3, 4, 5, 6, 7 days, 3 to 10 days, the body undergoes contraction. So things start to get really, really tight. Okay.
Okay.
And so it's, during this time that the stretches become really important, that you follow according to your myofunctional therapist. For patients with excessive wound tightening, there are different protocols to mitigate it. There are stretches to do. There are lasers you can explore. There's serapeptase. Those are things that you do early on. And then later on, there are also other interventions that we can do, including, non-invasive laser modalities, as well as Kenalog steroid and other stretches to make sure that you get the best result. And in our institute, we've actually developed a grading scale called the WIMS scale that we're validating and publishing on, so that we can accurately, score the wound healing after the procedures, and with good research and evidence, tell them, hey, this is what you need to do. This is not going to work for you, according to the patient's phenotype, but also their time. And good research and evidence, tell them, hey, this is what you need to do. This is not going to work for you, according to the patient's phenotype, but also their time in the wound healing process.
Okay, so the wound also it's a diamond. We don't want it to heal like that. We want it to heal like this.
Right.
Correct?
You don't want it to reattach. So you'll have like a little line that goes up and down your tongue, and those are the sutures. And so we want the tongue to stay healed like this, up and down, rather than reattach, meaning that the top reattaches to the bottom. So we don't want it to squeeze back down. The natural orientation that those collagen fibers will want to kind of pull back in. So early on, you have a lot of type 3 collagen that pulls things from all directions. Later on, you have type 1 collagen that's more linear. And so when you have excessive scar tissue kind of pulling in from all directions, kind of want to reorient that. So it's just in the linear dimension. You do want some scar tissue to keep the wound closed, but not so much that it's creating excessive tension.
Got it. And so for those out there, for me, this is what was so great, and I'll share this, if you guys are interested in dealing with, in getting a consultation with Dr. Zaghi, is I did it over Zoom. I'm in Las Vegas, he's in LA. I'm actually flying. I was going to drive. I'm actually going to fly in that morning, and then I've got a friend that's picking me up. We're going to drive back. So even if you are in some other state, if it works out, you can easily go see him and fly back. So we'll do our follow-up on Zoom.
Absolutely, yeah. So for patients who are interested in coming out of state, we have a pre-screening process. We meet with one of our case coordinators who goes over everything with you, make sure you're the appropriate candidate, that you have reasonable expectations, make sure to get a CT scan or a sleep study, or all the work that's necessary, and make sure that the person understands our philosophy, that it's function first and surgery second. And at that point, I meet with the patient to confirm the diagnosis, the treatment plan, and once the patient is, ideally ready like yourself, you can fly in, fly out the same day or the day before. We have a lot of patients who like to travel to us so that they can have just the confidence that everything is being done according to the best protocol and best evidence that's available. So
right, especially if you've been diagnosed that, hey, you have maybe a trickier tongue tie, it is worth. I can tell you, this experience has been, like I said, so much more than I bargained for. But I have to say, I have never had a medical experience this thorough in my life, and I've done a variety of things.
Much.
So from that standpoint, the care has been incredible. My Dr. Manueli, who happened to be my daughter's orthodontist as well, just worked out. You recommended him for my marpe. It's been an incredible experience. I'll be interviewing him on August 12th to share that experience. I also have another question. Can this cause or increase gastroesophageal reflux?
Yes, absolutely. So when you have a tongue tie, first of all, it affects your chewing and swallowing. So you're not chewing and swallowing with the most efficiency. And it can also cause, problems with swallowing. There are babies who swallow air when they feed, and that causes upset stomach. But in addition to all of that, when you have a tongue tie, you may have difficulty sleeping on your back. When the tongue falls back, it can block your breathing. And when you come to arouse and breathe again after an obstruction, you can also get acid reflux in that way. And so releasing the tongue ties, releasing the posture. We've seen people who've had like chronic constipation, gut issues, have that resolved through from the fascia aspect, but also the chewing and swallowing and sleep aspect as well.
Let's see here. I have a couple more questions before we end. Let me make sure I've got, what are some of the most profound changes you've seen in patients that you've released tongue tie? You have an all-star student or something that you were like,
yeah,
wow.
Absolutely. Early on, I would have to say it's the posture. You're working on the tongue, and I think I had like a 7-8-year-old who's saying that his muscle tension got improved, voice, singing, speaking, and something that's kind of odd that I don't get into too much is a pelvic floor dysfunction.
Oh my
So
God, I have some of that. I think I
yeah.
got some of that.
And urological issues. And so just because of the audience that you have, I've had women who say that they've had trouble with orgasm, and then after the procedure, they just feel a lot more
This is
connected.
exciting.
But I don't get into it too much. I kind of like brush
Yeah.
over that aspect of it
I will.
and
Yes,
focus
you know
more
what?
on the chewing, swallowing, and I'm like, okay.
Well,
So I
I
haven't
don't
really
have.
researched that one too much.
I don't have a romantic partner yet, but when I do, I will report back. If that is a positive thing, I will be shouting it to the rooftops. You know, as your spokeswoman for that, because that is yeah, that's a big one. Let me see. Hold on. Also, let's see. Okay, so what advice do you have for someone who might be dealing with any of these issues? What's the you got these people that are saying, you know
Find a
what,
myofunctional
maybe,
therapist. Yeah, your first point of contact isn't going to be the surgeon,
or the
okay?
dentist.
Or dentist. It's going to be a myofunctional therapist because they're going to have an unbiased perspective in terms of getting everyone that you need. They're going to get your team. So if you have a myofunctional therapist in your area near you, if it's one of our Breathe Institute trained therapists, those are the ones that we put a stamp on, okay? And we also have affiliate offices throughout the country where you might find these groups of individuals that we know they have the whole package that you need to solve the problem. And so you go for your appointment. They'll do a thorough consultation, talk to you about the treatment planning, whether or not you need body work, what kind of body work you need, the myofunctional therapy exercises, tongue space related issues, and then you can pick your surgeon. Make sure to meet with the surgeon, and ideally the surgeon will evaluate not only the tongue tie, but also your myofunctional readiness and your tongue space issues and any body physical therapy issues that you have going on. And from there, when you have your whole team behind you, you're going to be ready for success.
Are you a fan or not of doing all the myofunctional therapy online versus in person?
It depends. It really depends. If you have an excellent Zoom connection, like you have like fantastic lighting, okay, you're in your home environment, you have your tools, it's actually going to be better for you to do it online because you don't have to go, drive, park. You have your environment where you're doing exercises, you have your mirror, and you're going to have a great experience. If you have a poor connection, you're not so used to using Zoom, if it's a child who has, screen fatigue and things like that, maybe you want to go be seen in person. The ideal is, maybe a combination where you're a couple sessions in person, maybe some in Zoom. If you like to be seen exclusively in person and that works for you, that's fine. But it's not always necessary to go to every appointment face to face.
Okay, last one. Tell me, just to wrap it up, you had this done. Why did you have it done? You had the marpe, and what's been your experience for you?
Yeah, absolutely. So I didn't have a tongue tie release done. I had the marpe palate expansion.
Oh, I think you had both.
I had deviated septum, nasal blockage issues from a very young age. I have my journey on my Instagram if people want to check it out and scroll through. There's a little case study in which it shows me from a young child developing these issues, and then it shows me how I went to get it resolved. But I had a palate expansion and nasal surgery done. My two kids, they did have tongue tie surgeries, and everyone's got to do the treatment that's necessary for them. It's not a one-size-fits-all solution that everybody should get tongue tie release or everyone should get palate expansion. You have to have the appropriate treatment, and that's why we provide the research, education, and why you want to choose a provider who understands everything that you need. So it's not just a shot in the dark. You're going for gold the first time.
Okay, I have one last question I forgot to ask. The nose. The nose, you're an ENT.
Yeah.
Sometimes you go in and it's not just the tongue tie release.
No. Yeah.
It's this, or maybe it's not this, but it's this. Can you give us a little bit of that?
Let's say you have a deviated septum. Let's say you have allergies. Let's say it's a child with sinus or adenoid issues. If you can't breathe through the nose, the tongue is going to learn to stay down, whether or not you have a tongue tie. And as the tongue learns to stay down, you can get fascial adhesions that cause it to stay down more. It will then alter the growth of the mouth that makes it more likely for the tongue to go lower and lower. And so in those circumstances, the ideal treatment isn't tongue tie release. That's not going to work. You have to clear the breathing, okay? Retrain the tongue, make the space. And sometimes you don't need a tongue tie release at all. So it's really case dependent. And we have to recognize that tongue tie is only one cause of low tongue posture. And low tongue posture can be caused by nasal obstruction, low tongue tone, poor body posture, fascial restrictions, as well as inadequate tongue space.
Oh, that's amazing. This has been so engaging.
Yeah.
I'm so excited to
Thank you
share
so
you
much
with the
for inviting
world.
me on. I
Yeah.
don't do this a lot. I don't even know how to, join the Instagram live, but I had such a great time with you.
Oh, me too. I'm looking forward to. We're gonna videotape for everyone out there. When I go to my appointment, we got Dr. Zaghi's staff. They're going to be recording the experience so that I can bring it back to you. You can get up close and personal in my mouth and see the journey of the actual procedure as well as post. Like I said, I pray that this is incredible result. I know it's great. It's already been, even just having the expansion has been incredible. And like I said, I just want, if you're out there, if you are suffering from any of the things we've described today, please please look into this. This may very well be a solution to a lot of the issues that you have, and that would be amazing. It is worth all the effort I've done to get here, to have even 50%, 30% of what I've been feeling in my body to have relief. It'll be worth it.
Amazing. Can't wait to take care of you. Can't wait to see you next week. And a big thank you to all your viewers that tuned in. Go ahead and follow me on Instagram. Send me any questions you have. We're always looking for opportunities to provide great educational content. So let us know what's on your mind and how we can best support your education and health journey.
So he's Dr. Zaghi, and then the Breath Institute. You can find both of those on Instagram and follow them both. In fact, you guys, the Breath Institute is a plethora of information. It'll be your new favorite website to go. There's so much, you'll go down the rabbit hole, so many different things to learn about. So thank you guys.
Amazing.
Thank you, Dr.
Thank you
Zaghi.
so much. Hope this
All
was
right.
helpful for everyone. Let us know your thoughts.
All right, take care. Bye-bye. That was it. If you had any more questions, please, you can drop them below. You can DM me. You can DM Dr. Zaghi. I'm here. I'm sharing my journey because I want to help others. I want to help others with living your best life, with feeling your best. And okay, let's do this thing. Tuesday, I will be releasing. This is the last look. That's the before, and we'll be stay tuned for the after. Okay, take care.